Good afternoon, everyone, and apologies for the delay in starting. Welcome to what is the penultimate webinar in our series looking in detail at each of the expectations for local authorities in the new school attendance guidance from September. For those of you who don't know, my name's Adam Luke and I head up the attendance policy and strategy team here at DfE. Before I begin, could I just remind everyone that this session is being recorded. If you don't wish to be part of that recording, please leave the session and you'll be able to watch it back afterwards. All of the previous sessions can be found on the DfE YouTube channel if you missed them, and this one will join them. Super, let's get started. Next slide, please. Thank you. It's my pleasure this afternoon to welcome Jane Walker, Sarah Wintringham and Tara Prescott from Northumberland County Council. They're joining us to share their effective practice from their local authority, and I'm also joined by my colleague Andrew Baxter, who heads up the Children in Need Outcomes Unit here at DfE. But as is usual, before I hand over to Jen and her team to talk through what happens in Northumberland, I'm going to start with an overview of what the government's expecting from September and what the guidance is specifically for pupils with a social worker. Next slide, please. Super. For those of you who joined us for the first time, or for those of you who've been to previous sessions, just a reminder that the government published its new guidance for schools, trusts and local authorities back in May, and that guidance comes into force on a non-statutory basis from September of this year. The guidance shifts the emphasis away from over-reliance on legal intervention to a process of support first by setting clear expectations of what all partners should do to prevent patterns of absence from developing in the first place through promoting good attendance. Shifting to a world in which early intervention is the priority, using the data to spot patterns of absence before they become problematic and persistent, working with families at that point to remove the barriers that they face through better individual support on attendance. And then finally, as you've seen there, further targeting support for the persistent and severely absent pupils for those of them who are already in that category. And as you'll know, if you're watching Progress of the Schools Bill, the intention is for that guidance to become statutory, but that won't happen any sooner than September of 2023. Next slide, please. As many of you will be aware, if you've seen that guidance, it sets out three main responsibilities for local authorities, and today's session focuses on the last one of those, monitoring and improving attendance of children with a social worker through the virtual school. And it's a different type of responsibility to the others we've been talking about in previous sessions. Number one, because it isn't new, in that it's already expected of local authorities through the expansion of the virtual school head back in September of 21. And secondly, of course, it's for the vast majority of the cohort, save for those looked after, it's about taking a strategic view and removing the barriers to attendance for the cohort as a whole, rather than about the individual support in the way that we've been focusing on in other sessions. Next slide, please. And again. Lovely. So let's dig into what that means in practice now. In addition, really, to the benefits for all pupils that good attendance means, it's doubly important for pupils with a social worker, as many of you will know, because being in school and being engaged in education is an additional safeguard and an additional protective factor. But as some of you will know, despite that, absence for pupils in that category has been historically higher. And back in 2019, in the Children in Need review, we found that a quarter of children who'd ever needed a social worker had been persistently absent, compared to 10% of those who hadn't. And as many of you will also know, the success of the virtual school head in improving outcomes for looked after children was expanded, saw an expansion of the role of the virtual school head to include this strategic responsibility for children with a social worker. Good attendance is a key feature of that, alongside the other expectations around improving aspirations and building closer relationships between schools and local authorities. All local authorities are eligible to receive continued grant funding to support the virtual school head in delivering that responsibility, and are asked to participate in the research programme to help the department understand the impacts of the new duties and identifying emerging practices that can help other virtual school heads deliver their role. And as I say, it's just worth reminding everybody that extended role for virtual school heads doesn't mean providing direct intervention, help and support for individual children in that cohort, unless of course they're receiving support through the wider attendance or social care offer that we've been talking about in previous weeks. It's instead about thinking about the strategic leadership to champion their attendance, to champion their attainment and their progress. And all the details, as well as the bit that I'll come on to in the attendance guidance, all the details on the expanded role of the virtual school head is in the department's guidance on the role of the virtual school head. That was updated last month, and it sets out, it's called, for those of you who want to look it up, promoting the education of children with a social worker. Next slide, please. In terms of what the attendance guidance specifically says then about the role of the virtual school head, I should just, before delving into it, actually, I should just reiterate again, another common misconception we've had is that attendance of children with a social worker is solely the responsibility of the virtual school, and it's different to the other processes and the support that schools and LA should be providing. That isn't true. It's by no means the only responsibility. It's sitting with the virtual school head. The same support that schools, that trusts give should be provided, and similarly in the local authority attendance support team, it's that the virtual school head's an additional champion. And as we talked about when looking at school level focus, either in helping a school to look at their data or in what the school is doing in terms of its strategy and its attendance policy, they should certainly be thinking about children with the social worker in that. But in practice, the expectations on attendance are 5 things really. Number 1, regularly monitoring the attendance of children with the social worker in the area, breaking that down and including the group who are looked after. Secondly, setting a clear aspirational target for pupils with the social worker in the area, both as a cohort, but also making it standard practice that an aspirational target will be set in any personal education plan that is being developed for pupils in the group. Thirdly, providing training to designated teachers about their role in promoting the attendance of children who've ever needed a social worker, ever seen children. Fourthly, continuing the move on the in-depth role that the programme has had for looked after children, so acting as the corporate parent, securing the regular attendance, providing advice and guidance about the importance of attendance to those groups, and making sure that other services are working with looked after children in a consistent way, and understand and know the importance of attendance and are building it into their work. Fifthly, working across children's services within the local authority to make sure all social workers recognise the importance of good attendance, but also that it's built into early help plans, it's built into children in need plans, and it's built into child protection plans where there's an attendance issue in the family. And this all sits alongside updates the department's made to keeping children safe in education back in September 21, which gave the designated safeguarding leads in schools additional responsibilities for educational outcomes of children with the social worker as well. And that can all be found in keeping children safe in education. And just before I finish, it of course goes without saying, but just a reminder that partnership working in this way, making attendance everyone's business, is all cognizant and reliant on sharing information between education, between social care and any other relevant partners, making sure that everyone who's supporting the child can work as effectively and as efficiently as possible. And one of the big changes in the new attendance guidance to help make that happen is the expectation on schools to inform the child social worker if they're unexpectedly absent. Super. That's it from me for now. Questions in the chat for me and for other speakers, and we'll try and pick them up at the end. But without further ado, I shall hand over to Jane and colleagues from the wonderful county of Northumberland.
Jane, can you share your slides, please?
Yeah, can you see them?
I can. One moment. There you go.
Okay. Well, hello everyone, and thank you for inviting us to talk about Northumberland, our virtual school model, and our approach to improving the attendance of children who have or have had a social worker. As Adam says, I'm Jane Walker, Northumberland's virtual school head teacher and a senior manager in children's services. With me in the meeting are two of the team managers who work with me. So Sarah Wintringham, our Principal Education Welfare Officer, who manages our attendance support team, which is the Education Welfare Service, and Tara Prescott, our Deputy Virtual School Head Teacher, who manages the Education Support for Looked After Children team, known as ESLAC. I think there are other virtual school colleagues in the meeting too, actually, and we hope you enjoy some of the views of Northumberland in the presentation that might give you a bit of an insight into how proud we are of our county and what life is like for us working up here. There are 2,000 square miles of Northumberland and 97% is classed as rural, but over half the population lives in the 3% that is urban, and most of that's in the southeast corner. We don't have a motorway or city or university or Premiership football club, but there are 163 schools and a number of registered and unregistered alternative providers who educate just under 45,000 children. Before the pandemic, school attendance in Northumberland was good. For at least the 3 years previous to that, it had been improving and as good as or better than national and regional averages in all measures. Statistical data, as you might expect for the academic year 2020 to 21, shows what we already know, that we've not yet returned to our pre-pandemic position, but we do still compare well to the national picture. I think perhaps a brief backstory about the evolution of our virtual school might be helpful. Northumberland's virtual school came to life in 2011, following a service restructure when I was appointed as our first virtual school head teacher. I was an advisor in the education service at the time with a fluid but huge portfolio of responsibilities that somehow fitted under an umbrella of inclusion support services. It marked the beginning of my working relationship with what was already the well-established Education Support for Looked After Children team and responsibility for children missing education and elective home education. Things evolved quickly from there. By 2015, when Keeping Children Safe in Education arrived, we'd not only grown our own school safeguarding team from within my group of services, providing support and training to designated safeguarding leads and engaging schools with children's social care, but we had our own subgroup of the Safeguarding Board, which is now called the Schools Engagement Subgroup, and the board is now the Northumberland Children's and Adult Safeguarding Partnership. The new DCS in 2017 shared the vision that all of my services should be called the virtual school and that my line management would be through children's social care and directly to her. She wanted all local authority education services that were subject to Ofsted inspection to have the oversight of the virtual school head, and that's where we are now. We look at education support services through a safeguarding lens, focusing on children with a social worker or who have previously had a social worker and children not in school. So why is it important to understand our evolution? Well, because it gives us a strong starting point in 2021 when virtual school heads were given their extended duty to promote the education of children with a social worker. We already had an infrastructure in place that was fit for purpose. So this is us today, a group of services that has enjoyed relative stability since 2017, teams that deliver statutory services for the local authority. There are a lot of us, and that helps. There are 67 staff members from a range of professional disciplines organised into 4 teams. Reporting to the DCS gives us strategic breadth. The safeguarding lens I mentioned earlier is still there. We demonstrate the strong integration of education and social care services in our delivery, and there is governance through the MALAP, which is the Multi-Agency Looked After Partnership, to the Council's Safeguarding and Corporate Parenting Advisory Group. We like the way the title of the new guidance, Working Together, echoes the Working Together to Safeguard Children guidance. To be a bit more human about it, our responsibilities are for particular groups of children, and we provide training and support for many professionals, but specifically these school leaders, children's social workers and foster carers. So how do we identify and address the barriers to attendance for children who have or have had a social worker, which obviously includes looked after and previously looked after children? A strength of the model, and really what makes the model work, is the strong communication network that's been in place for several years now. It was tested to the limit during the pandemic and was the reason that we could be reassured about the eyes of professionals being on children when they weren't in school. We're continuing to build on this strength. Tara takes the lead with designated teachers, Sarah with attendance leads, and Carol, who's not in the meeting, with designated safeguarding leads. The alternative providers network there in the attendance leads column is very important to us from an attendance perspective. Most permanently excluded children in Northumberland go into AP, and most of that AP is unregistered. We have quality assurance processes in place, and education welfare is very active with a protocol to monitor compliance of APs with the independent school registration regulations, and a lead education welfare officer has a responsibility for improving attendance at APs. We're all involved with social workers, although I tend to take the lead so that the influence is top down. I also have a profile with the others. So, for example, I chair the schools engagement subgroup and deliver training to designated teachers, etc. We're therefore working closely with school leaders using this communication network, which is vital for identifying barriers to attendance for children who need help. Our strategic position at the centre of children's services means that our influence at operational and practice level is considerable. There are so many ways in which we work with so many partners to identify where attendance is an issue, where attendance needs to be part of the plan, and where we can target resources to make a difference. The inclusion agenda in Northumberland is challenging. For example, there's only one pupil referral unit with only 40 places for children up to the end of year 9, so no Key Stage 4 provision. So the virtual school is involved in the development of strategy in these areas. Risk management is part of our core business that involves us in the planning for children with the most complex needs. Through the school's safeguarding team, we coordinate programmes such as Operation Encompass and our own Operation Endeavour, which is for children who go missing. We're co-located with Northumberland Adolescent Services, and that includes Youth Justice and the Leaving Care teams. And we have representation on all panels that ensure children get the help they need, from the SEND panel to Legal Gateway, which is planning for children on the edge of care. And as already mentioned, we're represented on all subgroups of the Safeguarding Partnership, as well as chairing one of them ourselves. A member of the school's safeguarding team is based at the front door to children's services and on a daily basis responds to CCNs and is involved in the triage. There is potentially a downside of all teams working with me, in that there could be a perception that attendance is only the virtual school's business and not everyone's business. But our influence across all of these areas, the multi-agency and multidisciplinary processes, ensures that really this isn't the case. So how does being managed through social care work well in practice to impact on attendance? 2 years ago, Northumberland began implementation of the Signs of Safety practice model. I'm sure many or most of you are familiar with it. Our virtual school methodology aligns perfectly because we make high-level contributions to planning for children. We led on the implementation with schools and education services. We model the approach in all aspects of our practice and have a shared understanding of impact. Where attendance is concerned, this is particularly important. Where poor school attendance is seen as a symptom of something else and means that professionals have to work together to identify the underlying factors. Our role in the virtual school is to make sure that attendance and education are part of the plan, and that professionals, especially social workers, ask the question without being prompted: if a child is not in school, where are they and are they safe? Attendance was already in our referral thresholds, and in the past initiatives like Troubled Families have helped raise the profile, where attendance is one of the threshold criteria. The elements of Signs of Safety support our attendance improvement agenda, and I think will give structure to our attendance strategy as it emerges. For example, the use of rapid safety plans, good quality information in mapping, worry statements, success goals, and scaling questions. The methodology takes us from identifying barriers to attendance and into the plan to improve attendance. A little bit more about our attendance support team, the Education Welfare Service. This is the current staffing. fabulous people, but not enough posts. And this is a snapshot of where we are now as the academic year draws to an end. Just to highlight from here a part of our core business that identifies school attendance issues for children involved with social workers. And that's our multi-agency safeguarding process, which is in place to track children at risk of missing education. For example, children who receive multiple fixed term exclusions, who are on part-time timetables, or who attend alternative provision. A monthly return from all schools, APs and local authority services like SEND, ESLAC, admissions is used to refer children not in school to a monthly CME tracking panel. There is vigilance in this system, which makes us work together to identify hidden communities, unknown children and barriers to learning. As this academic year draws to a close, we're tracking almost 750 children at risk of missing education. Perhaps proportionately low numbers, however, had previously had a social worker. So, for example, only about 15% had early help assessments, 8% were children in need, 3% on child protection plans, and only 5% were looked after. So the process is multi-agency and another opportunity for us to reinforce our message about school attendance being a priority. The question again, if children are not in school, where are they and are they safe? What else helps? Well, it's not just about infrastructure and systems. For me, it's mostly about people. I think we have the right posts, but more importantly, we have the right people in those posts. These are the skills and experience that just the education welfare team bring with them to the virtual school. So they use that experience and expertise to identify barriers to attendance and have lots of tools in their boxes to come up with ways to overcome them. Our approach to the extended duty for virtual school heads is merging with our approach to implementation of the new attendance guidance. I think, as Adam set out at the beginning, the aims are the same, if not very, very similar. And I think working on both concurrently for us is keeping the agenda fresh. Excuse me. In Northumberland, we've taken a project approach in response to the extended duty and have 4 different work streams working with children's social workers and designated safeguarding leads. Sarah and Tara each lead a work stream, attendance and behaviour respectively. A year after the extended duty was introduced, we're therefore well prepared to respond to and implement the new attendance guidance. The picture on the previous slide was a recent issue of the project newsletter for social workers and designated safeguarding leads that had a focus on the attendance work stream. I think as local authorities, we've all been busy responding to the extended duty and new guidance and have probably done lots of similar things to build on the attendance support we already had in place. So I'm going to focus on just a handful of key things we've done or are planning to do that we expect will make a big difference in light of the new guidance. I've separated the actions as things we were already doing but are now doing slightly differently, and new things that we've introduced or will introduce in the next 12 months. So we've fully embedded the signs of safety methodology, not just in the way we manage meetings and documentation, but as a way of monitoring and review with our staff and partners. We consistently frame our practice around what's going well, what we're concerned about, and what we need to do next. For us, the most obvious thing to do was to grow the education welfare team. There already weren't enough education welfare officers to meet the demand for the service pre-pandemic, if I'm honest. So last year we appointed additional staff to target children with a social worker who are the poorest attenders. And as virtual school head, I was able to use the grant funding for the extended duty to help us do that. Integrated working between education, welfare and early help was already strong, becoming stronger during the pandemic, but we added to that, and Sarah will tell you more about that in a moment. We know that our CME arrangements work. There's already the monthly CME tracking panel, but we tweaked the process by introducing themed panels, for example, to track children with a social worker. And this system will produce our children not in school register. We also tweaked, done a lot of tweaking, we also tweaked the existing social care and case management system. We use Liquid Logic in Northumberland by creating a tab that shows when a child has involvement with education welfare, and it's made this group of children visible to social workers. So we are doing different things, and many of the ideas on this list are Sarah's, so she's going to tell you more herself in a moment. Perhaps one of the new initiatives that's going to gain momentum and have most impact will be working with schools and social workers to better understand our context, or as the new guidance promotes, using data to inform practice. An example of that is looking at case closures. So our data unit can provide us with an exception report each week to show from the early help and social care cases closed the week before, how many of the children still have attendance, either at 90% and below or 95%, whatever we request. These cases can be immediately allocated or reallocated to education welfare officers. And at the moment, we can use our team member at the front door to find the attendance information for individual children. But when the data collection is electronic and almost live, this is definitely one of the benefits we'll take advantage of. And we're considering introducing a panel or meeting to provide professional challenge to that, which will be led by a social work manager or advanced practitioner. So you'll have picked up that a lot of our work involves early help and is not all about children now open to social care. Well, our justification is that we're interested in the attendance of all children. Our starting point with this work was so well established because of our established virtual school model, but also quite a high number of children in Northumberland bounce between early help and social care. So are not only children who've previously had a social worker, but children whose attendance continues to indicate underlying issues. Sarah is going to tell you more now about this ongoing work. So, Sarah.
Thank you, Jane. Just get my information up. Okay, so Jane kind of just touched on it there, but we feel that the joint working between early help and educational welfare is essential to avoid escalation of poor attendance and other associated negative behaviours. Early intervention has more chance of addressing emerging patterns of absence, and making full use of the support available from different teams helps us address problems beyond the capacity of just one team who's able to deal with it. And we know that both education welfare and early help often work with the same children and families, and coordinate our interventions mean we have more chance of having a long-lasting impact. So I'm just going to talk about some of the interventions we have. So we've got education welfare support officers. There's going to be the introduction of some education early help assessment workers. We've started running early help clinics and attendance workshops. So our education welfare support officers, they've been in post for about 18 months now and were appointed on the back of the pandemic. They are a crucial role for us to help support our children back into school. We realised that there was a huge gap between students not attending school and the extra support that was needed that maybe couldn't be accessed by other services at that time. So education welfare support officers work on a one-to-one basis with children identified who've been out of school for long periods of time, may have some anxiety following the school closure period during COVID. It's a really tough job. They do work one-to-one with the children at home if needed, but their real aim is to support that transition back into school. They have a child-centred approach, and they build up trusted relationships with students and become the student's voice and their advocate for school. And they can also spot what other gaps need to be filled to enable that young person to feel safe and able to attend school. So we currently have 4 education welfare support officers within the team. A new implementation, which is probably coming in place from September, is our education early help assessment workers. And they are there to strengthen the use of the early help assessment and team around the family process in education settings. So this will be where needs are identified, which possibly could be low attendance. The early help assessment will ensure that a family focused, holistic view is gained on what the barriers may be to attending school. Hopefully we'll have well facilitated TAF meetings to ensure a robust multi-agency plan is created with families and can address any of those barriers. And where attendance is a worry, education welfare officers will be key members of those TAF meetings. We also have our early help clinics, and these started in the 21-22 academic year, and they were offered to 4 schools after a data analysis had suggested that they would have the most impact in those schools. The clinic's aim is to discuss students who are not open to an allocated worker and where the school have been unsure about what support options they had or what support was currently in place that might not have been working. So representatives in the clinics include the early help first contact team, family workers, education welfare service, SEND support service and primary mental health team. And the clinics also work to strengthen the relationship between all the partners involved, so we have a wider impact on those students that are discussed. And a number of our schools have requested such clinics, and this work will be further developed and continued into the new academic year. Another strategy that our education welfare officers implement is our attendance workshops. So this is a tool to run small group intervention sessions with students. And the education welfare team have all had coaching and are now able to develop this intervention, which aims to prevent students from becoming persistent absentees. So the objects are to raise student attendance and reduce PA, to identify the correlation between their attendance percentages and the days, lessons and hours of learning missed, to ensure that students understand the consequences of being a persistent absentee and the longer term impact this can have on them, to let them understand what the role of our education welfare officers are and that they're there to support them and to support them back into school. We talk about the statutory processes involved with when attendance is a real concern, and we also use statistics from government website to enforce why attendance is such a high profile. Over to Julie.
Thank you, Sarah. So my slides have stopped advancing. So let me see. Has somebody taken control of the presentation? Let me just try again then. So Sarah, I'm going to show your lovely slides. There we go. And apologies to everyone if you didn't see these, but as Sarah talked through them. So she talked about the education welfare support officers. Somebody's taken control again. Let me do this one more time. There we go. Right, it looks like I can't advance my slides here, sorry. Let me get back in.
If you just share your slides on the system and leave it, and I'll put you back up onto the screen. Just give me a moment.
Okay. It doesn't actually let me stop presenting from this end, actually.
It should work now.
Yes, thank you, Vicky. So yeah, and the education help, early help assessment workers, the early help clinics and the attendance workshops are all things that Sarah's just talked so articulately about. So one of the benefits of these services all being managed through the virtual school is that we can learn from what we know works. Attendance of looked after children, who are children with a social worker, of course, is a good example of that. These are some of the strategies we use in different measures for different children to stabilise and improve school attendance. Tara leads the behaviour work stream of our project to promote the education of children with a social worker. In her recent issue of the project newsletter, which was focusing on behaviour, she included a section on what designated teachers tell us work with looked after children in school. So we're building on this to apply to children in need as well. But really, one designated teacher summed it up by saying that it's all about relationships, really. And of course, it's right that we position ourselves as good corporate parents here and do everything we can as responsible corporate parents to make sure our children attend school. We're implementing a whole council approach to corporate parenting at the moment that will help to ensure that attendance is a priority for all frontline services. Although I would say this because I'm the founder and the chair, the schools engagement subgroup of our safeguarding partnership has played a significant role in supporting schools to understand the wider safeguarding agenda, local policies and practice, partnership working with other agencies, and how to contribute to improvements for higher safeguarding standards. The group has a work plan with priorities that align as far as possible with the priorities of the partnership. And in previous years, there's been great work done around making a good referral, interpreting thresholds, the emergence of early help services, and most recently, the science of safety practice model. This group's already involved in the extended duty and will have a key role to play in fulfilling the new attendance guidance. And so to impact. We're doing a lot, but how do we know that it's working? Well, I assume like everyone else, we want to see the outcomes improve. But we want to be more diagnostic than that and make sure that we're intervening as early as possible. What we've been developing through the social worker project is a dashboard that we're calling for now a new wave dashboard. The data unit's working with us on this to dig deeper into the factors that might impact on attendance and progress, for that matter, of children open to social care. The picture that will emerge from this will draw a range of council services into the attendance as everyone's business approach. So, for example, housing, youth justice and health services. And we are committed to the qualitative and quantitative signs of safety meaningful measures to make sure that children are living as safely and securely as possible, and families and staff from all services work with each other to make things better for children. Part of those qualitative impact measures will be case studies, and already we're able to see the impact of our work for individual children. Sarah has quite a few case studies to exemplify this, and we'll talk you briefly through one of those now.
Yes.
So Sarah, let's try again.
So we had real worries about one of our young people in Northumberland that hadn't been in school at all this year, and attendance prior to that had also been really poor. She had been on a child protection plan since September 2021, and as I just mentioned, had 0% attendance. We were really worried. She didn't want to talk to professionals. When people would go and see her, she wouldn't undertake any meaningful work, which had been really hard to identify what she wanted and for her voice to be heard. We had concerns that parents weren't engaging at all times and were avoiding professionals. She was becoming isolated due to rarely leaving the house. There were poor routines and boundaries in place at home, poor sleep pattern. She was awake through the night and sleeping all day. There's a history of poor parental mental health and substance misuse, poor home conditions. The family have 2 large dogs which stay in the home and are quite aggressive when professionals go to the door, so that kind of made it really difficult to gain entry and to speak to parents and the child. We were worried that she might become vulnerable to criminal and sexual exploitation due to the number of other adults that were coming in and out of the house. And we felt that there was some trauma there from losing her dad and a mum's recent bout of poor mental health. So what we did was the family had been on education welfare for a while, but we didn't feel that kind of going down that legal route was appropriate in this case. So we allocated an education welfare support officer who became part of that child protection plan. It's been a really long process, and initially she didn't want to engage with the education welfare support officer, so this was just about being there all of the time, making sure, yes, I'm going to come every day, I'm not going to go, and small steps were made, and she gradually started to kind of take her hood off when the worker got there and started engaging in conversation. I think we realised quite early on that it was going to be really difficult for her to return to school. So we worked closely with the school, and they agreed to put in some alternative provision for her as that bridge in the gap between kind of getting out of the house and being somewhere before making that full transition back into school. So where we are now, that we have secured a place in alternate provision, we've managed to get her out of the house to visit on 3 occasions, and she has gone for 1 session. She's still a little bit reluctant to engage and to tell people how she feels, but the education welfare support officer has been relentless, and she is there to see her every day. And that's given a lot of consistency as well. It's that same member of staff who she's starting to now feel safe with. We're trying to kind of gain her views so we can feed them into the care team meetings. And there's regular communication with children's services and education welfare. So although we're not fully where we want to be, we've made huge steps with her, and we're hoping that the continued support from education welfare and the linking with children's social care we can eventually get her back into school.
Great, thank you, Sarah. So as you might expect, all of this is captured in a virtual school continuous improvement plan, and this in turn is part of the Children's Social Care Quality Assurance Performance Framework. We know we still have a lot of work to do. We're not there yet with everything, but there's definitely momentum for the attendance agenda gained through the extended duty this year. And we're confident that our evolution will continue as our plans are implemented from September. I think that's a good place for us to pause. So thank you very much for listening. Stop presenting.
Super, thank you very much, Jen, and lots of interesting practice in there for colleagues who are joining us. particularly some of the conversations I've had over the last week or so when I've had fun in the northeast, in Yorkshire, and in the southwest and in London, around building into plans and making it the key feature of plans. I'm sure the focus that you gave there and the explanation of how you did that was useful for colleagues. There aren't a great deal of questions for us. There was a question for DFE about will we be making the social worker a field in MIS systems, school management information systems like SIMS. As Andrew has said in the chat there's a piece of work underway to try and do that. In the meantime, the new data that local authorities have access to through the DFE portal does allow you to pull a report by social worker for children who for children in schools that have signed up to that pilot in the meantime. And then there was a second question about is the LA the corporate parent for children in need and those in child protection plans? And again, as Andrew said, no, that is, as we said at the beginning very clearly, that is only for looked after children. The emphasis on the children with the social worker who aren't looked after is around strategic support, but of course they should be looked at and supported with attendance support from the attendance support team, just like any other pupil would if they need it. But the focus of the virtual school here is around the strategic barriers. Super. Well, thank you very much, Sarah, and to Jane, and thank you. Lovely seeing all those great scenes of Northumberland as well. I'm sure people were sat there guessing them and guessing the names of them from holidays past, or hopefully for some to come for those in the summer. Thank you for everybody for joining us on such a hot afternoon. Apologies again for the technological issue at the beginning. If colleagues missed the beginning, you will be able to watch the whole recording on the DFE YouTube channel, and a link to the recording will be sent to everybody. But other than that, until we meet again on Friday at 11, for those of you who'd like to join us to talk about working with families to remove out of school barriers, when I'll be joined by Dorset County Council. Thank you for everything you're doing. Stay safe in the heat, and see you on Friday. Thank you, everyone.
Thanks very much, Adam. Thank you.